And now we're going to talk about Peters anomaly. Peters anomaly is a rare congenital form of anterior segment dysgenesis in which abnormal cleavage of the anterior chamber occurs. It is characterized by a centrocorneal opacity like glaucoma due to defect in the posterior stroma, descendant membrane, and endothelium. Peters anomaly is a bilateral in 60 to 80% of cases. It may be associated with other abnormalities of the eye, including congenital glaucoma, myopia, aniridia, iris coloboma, microphthalmos, persistent hyperplasia of primary vitreous, and optic disc hypoplasia. Peters anomaly may be caused by genetic factors including alterations of several genes like the FOXC1, PAX6, PITX2, or CYP1B1 genes, environmental factors, or both. Peters anomaly sign and symptoms. The most common sign is the corneal opacification seen at birth, while the common symptoms decrease vision by way of blockage of the central visual axis due to the corneal opacification will lead to deprivation of amblyopia. In addition, patient may suffer from glaucoma due to likely malformation of the angle structures as well as shallow anterior chamber. Peters anomaly have type 1 and type 2. The Peters anomaly type 1 presents with central or paracentral corneal opacity and iridocorneal adhesion. Keratolenticulaar adhesions are absent in this type, although the lens may be cataractous, while the Peters anomaly type 2 is a common associated with the denser corneal opacification. It presents with keratolenticulaar adhesions. Now let us proceed to the management. In management, we have lensectomy, vitrectomy, filtration surgery, cryoablation or tube shunt, pupil dilatation or iridectomy. In cases where both eyes are affected, the only way to improve visual acuity is through corneal transplantation. Surgery is carried out on an outpatient basis under general anesthetic. If the patient also presents glaucoma, this must be treated. Sometimes treatment with eye drop is enough to normalize the pressure, but at other times surgery is required. Lastly, if the child presents acute photophobia, wearing sunglasses may help. So before all, we have the consultation. We have pediatrician throughout examination to rule out other systemic abnormalities, neonatologist, which is below 1 year old, neticist, genetic counseling, glaucoma specialist, management of glaucoma. Most patients with Peters anomaly have glaucoma. No DFA-approved glaucoma medication are available for children. Vitreoretinal surgeon if lensectomy vitrectomy is necessary. Cornea specialist, keratoplasty, low vision specialist, management of poor vision, provision of optical aids. The last one is the prognosis. After all the management and the treatment, prognosis for maintaining clear graft after 2 years is low, as reported in the study. Due to the young age of patient, it is believed that immunologic rejection is the most common cause of graft failure. Graft failure rates have been reported to increase when combined with the lensectomy and vitrectomy. In addition, those with pre-existing glaucoma have a poorer visual prognosis.
Let's talk about corneal opacity. What is corneal opacity? Corneal opacity is a loss of normal transparency of the cornea due to scarring, trauma, and uveitis, and also aging. The cornea is a clear dome-shaped area that covers the front of the eye. Factors of corneal opacity. of vitamin A, eye injury, or chemical agents and foreign bodies. Pink eye or conjunctivitis. People who wear contact lenses. People who wear contact lenses will be complicated if there is an insufficient oxygen permeability of the contact lens, not comply to the do's and don'ts of wearing contact lenses, and poorly maintain contact lens and contact lens case. Types of corneal opacity. We have the nebular. Nebular is a faint opacity due to superficial scars involving the Bowman's layer and superficial stroma. Covers the pupillary area and interferes more with visions. Blurring of vision and irregular astigmatism. Nebular opacity is a mild opacity of the cornea, allowing the details of the iris to be seen through opacity. Number 2, we have macular opacity. It is a semi-dense opacity produced when scarring involves about half of the corneal stroma. Macular opacity is denser, through which the iris can be seen but the details are not visible. The last one is leucomatous corneal opacity. It is a dense, white, and totally opaque opacity of the cornea, obscuring view of the iris and the pupil. It is a dense white opacity which results due to scarring of more than half of the stroma. So we have adherent glaucoma, corneoiridic scar, corneal facet, and keratication. Nebular, macular, and leucomatous opacity. Nebular is a fog mist, cornea, very hard to see. Macular, stain or spot. Glaucoma, it has a white scar in cornea and easily seen. So what are the signs and symptoms of corneal opacity? We have the redness and swelling of the eye tissues and eyelids, tearing, blurred of vision, irritation, sensitivity to light, sensation of something in the eye, and eye discharge. Here are the list of congenital corneal opacities. We have the congenital hereditary endothelial dystrophies, posterior polymorphous corneal dystrophies, congenital hereditary stromal dystrophies, Peters anomaly, congenital anterior staphyloma, lattice corneal dystrophy, and cranial corneal dystrophies. Here are the list of acquired pediatric corneal opacities. Traumatic, congenital or infantile glaucoma, congenital corneal ulcers, and mucopolysaccharidosis. Loss of corneal transparency causes. We have the congenital degeneration, dystrophies of cornea, inflammation of cornea, corneal edema, drying of cornea, deposition of cornea. So here are the treatment of corneal opacity. We have the keratoplasty, optical iridectomy, phototherapeutic keratectomy, and keratoplasty. So corneal opacity is the fourth main cause of globally blindness, according to World Health Organization. Thank you. That's all.